What is a UTI? A UTI is an infection in your urinary tract. So you have your urethra, your bladder, and you have the kidneys. And the urethra is right there at the bottom. And what happens is during pregnancy, the pressure and weight of the baby could cause for your bladder to not empty all the way. And when your bladder doesn't empty all the way, it can cause a UTI. And another thing is when your urethra is so low down, it's exposed to everything, and it's just easier to catch infection. And it starts, the bacteria buildup starts right there in the urethra. So if you have like a UTI that is it's not no symptoms, you don't have any symptoms at all, that's gonna be a UTI. That could be more of the urethra. But once you start feeling symptoms and things like that, that would be more of the bladder. But again, sometimes you can have a UTI and not have any symptoms, and it could be in the bladder. What is important to know during pregnancy is you want to start your pregnancy off drinking a lot of lemon water. I would suggest putting lemon water in during the first trimester because it helps with reducing nausea, and lemon water helps with a plethora of things. So drinking lemon water every day, when you wake up in the morning, make a cup of 8 ounces and squeeze a lemon in, and you can start your day with some lemon water if you're able to stomach it. I also tell my clients, okay, we're supposed to drink half of our body weight in ounces of water each day, but you can also do lemon water. You could also put cranberry juice inside your water. 100% cranberry juice, just drinking it prophylactically. I did it throughout my pregnancies just to prevent UTIs. Is a good option for you to do during your pregnancy. Another thing is when you have intercourse, make sure that you are emptying your bladder directly after sex. Now, you could have gotten away with that before in the past life without emptying your bladder directly out of sex. But during pregnancy, again, the weight of the baby is pressure onto your bladder. Remember, the bacteria starts right there in the urethra, and so intercourse can introduce bacteria to the vagina. So you want to empty your bladder out before intercourse. And the next thing is, if you do notice that you have signs of UTI, some of the signs would be some back pain, like soreness, almost like a throbbing almost. It could be some cramping a little bit in the front. You can wipe and you might see a tinge of blood, but blood that can indicate a UTI. You can, if it's kind of more so a bad UTI, it would be like some vomiting and nausea, even if, or that could just be your body's way of responding to a UTI. But if you have increased vomiting, nausea, or if you're just not feeling right, you want to check to see if you have a UTI with your healthcare provider.